in the next minute or two, but let's go ahead and start since we're already 5 minutes in. I'll go ahead and read the land acknowledgement. Somebody put that up on the screen, please. So we recognize as the Community Advisory Council, we recognize and acknowledge the indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tenino, Klamath, Molalla, and Yahuskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children. And I shared a couple links in the chat acknowledging that this is National Native American Heritage Month in the United States. And the one is from the Department of Interior, who happens to be led by the first Native American to lead, to be in the presidential cabinet, Deb Haaland. So I figured that was appropriate since there's a Native American leading that agency to have to share their link. And then there's another link from KTVZ that's actually more local, issued by the Warm Springs. No, not the president. Anyways, it's local. I haven't had a chance to read it myself. I haven't read that one yet. So meeting practices, we do our best to make these meetings of the Community Advisory Council welcoming. And we do that by doing our best not to use acronyms, using plain language as much as possible, staying away from kind of lingo. And also, we really want everyone to participate who would like to participate. So you're welcome to raise your hand using the little toggles in the reactions in the Zoom screen. You can raise your hand there. You can raise your hand like this. You can, if it feels appropriate, unmute yourself and speak up. And you can also write in the chat. And we also do our best to, we know that some of us are quieter than others, and so we want to reach out as much as we can remember to actually call on people to make sure that, give you a chance to speak. And with that, let's do introductions of the CAC members. We've decided, as a way of saving a little bit of time, not to introduce every single person on the call because we have a lot of guests sometimes. So we are introducing CAC members, Community Advisory Council members, and anybody who's new to the group, a guest, or who has changed your title or position or affiliation since the last time we saw you. I think Kelly's going to help us with this.
Yeah, I will do that. Brad, did you want to do an official introduction of yourself?
Sure. I'm Brad Porterfield. I'm a consumer representative. I'm the chair of the CAC at the moment, and I'm also the director at the Latino Community Association.
Okay, next let's do Elizabeth and then Tom.
Hi, it's Elizabeth. I'm the vice chair of the CAC. I'm a retired vocational rehab counselor, she, her, hers. Thank you.
Hi, I'm Tom Kuhn, he, him, his. I am the Deschutes County Public Health CAC representative.
Mandy, then Connor.
Hi everyone, Mandy Seeley, she, they. I'm in Sisters and I'm a consumer rep on the CAC.
Hey everyone, Connor Carlson, consumer rep, and I work for Family Resource Center.
Next we'll go with Stacy and then Maida.
Hi, I'm Stacey Shaw. I am Cook County Health Department overdose prevention and regional prevention, also a community rep.
Hey, everybody. My name is Mayra Benitez. I am a consumer rep and the regional coordinator for Family Resource Center.
And then we have a new CAC member, our Jefferson County rep. Karen, can you introduce yourself?
Yes, hi. My name's Karen Correa, she, her series. I am Public Health's new Health Equity and Education Specialist and your new CAC member. And this is my son, Ezra, we're trying to get him back to sleep.
Great. And that is everyone for CAC.
Do we have any guests? Any people?
No other guests. We have our regular support of Kristen, Dustin, Caroline, and Tanya.
Tanya, yeah. Okay. Well, welcome, everybody. Let's go ahead and open it up for public comment. Any public comment? To give an example of public comment last time, I have a note that Elaine, I think it was Elaine, provided public comment around medical transport, and that's now on our agenda for today. So often public comment can lead to the full CAC talking about the subject you raised. So,
I have one, Brad.
okay. Who is that?
Mayra.
Mayra. Andale.
Yes. Thanks. So one of the things that I noticed is my children are on Oregon Health Plan, and I have private insurance through my work. When I went in to get glasses at the same place, my glasses came in within 2 weeks. And I actually had my appointment after my son or after my daughter. I went in and scheduled an appointment with my daughter. She was prescribed glasses and they took 8 weeks to get here. And so we had gone in because she had broken her other glasses. So she needed a replacement and she needed an update anyway. So they just went ahead and updated her prescription, but it took 8 weeks for her glasses to come in. She was in there before I was, and mine only took 2 weeks to come in. So that's there's a little bit of frustration there.
Thanks, Gwen. Kristen, you often have a response to these things. Is any chance you have a response at all, or questions or comments, or anybody else?
Yeah, and excuse me, I'm under the weather again. Our house just has caught every bug that's made its way through town, I think. Oh, shoot, my internet's unstable. I'm going to turn off my video for a second here. So I guess I'm curious, I guess I'm curious, and maybe I could send you an email, like where you ordered the glasses through. Did you follow up to ask if there was a reason it was taking so long? Did it have to do with a prior authorization on Pacific Source's end?
No prior auth, Kristen. This has been the thing with any glasses that I order for them. All 3 of my kids have Oregon Health Plan, and it's been the process every single time. So we ask because, obviously there's a difference for me since I'm on private insurance, and they said that's just the process. It takes 8 weeks for any Oregon Health Plan client to get their glasses.
There's a comment.
Would you tell me, can you tell me where you had those glasses made, or who you saw to process the glasses request?
Yeah, Central Oregon Eye Care.
Okay. Because I can ask the provider service representatives to follow up. Central Oregon
Eye Care.
Okay. And I think I just kind of need to follow up internally to ask if that is typically how long it takes. To be honest, vision care is only covered up until I think through the age of 19, I believe, unless there's another condition like diabetes or something like that. And And so I am not super familiar with how long it typically takes to make glasses because in my previous role, I did not work with anyone under the age of 18. So let me follow up and ask some questions. And Tanya put something in the chat, sorry.
Yeah. And Mandy also shared that she's had
Yeah.
the,
Oh, it was the same place, Mandy, Central Oregon Eye Care, but in Sisters?
Yes.
Okay. All right, I will follow up internally and then hopefully by the time we meet again, I'll have some more information to share.
Awesome. Thank you, Kristen.
Yeah, thank you for bringing that up. And my public announcement is that Central Oregon is having, our Central Oregon CCO is having our annual community conversation Friday, December 2nd. We'll be hosting a lunch at our office, and there's also an option to join via Zoom. And if anybody would like the invitation to either attend on Zoom or in person, let me know and I can send you the registration. And that's 12 to 1:30. Oh, yay, Mandy will be there. That's exciting. Looking forward to meeting you too.
thanks, Kristen. Is there a chance we could have that sent to all the CAC members?
Yeah, definitely.
Just, okay.
I might even be
thanks.
able to put it in the chat, but I'll make sure Kelly has a copy.
Okay. And I'm realizing, I just remembered that either Kelly or Michaela, you shared some announcements with me and I kind of lost track of those. Are those still, apologize. I don't want to forget to mention.
Yeah, no
You want to
worries.
mention?
One was to welcome Karen to the group. And then the other one was the Community Health Project. Full applications are coming in. We have about half of them so far, but they're due on Monday by noon. So we're going to get a mad rush of full applications coming in over the weekend, we hope. So yeah.
Okay.
That was really, yeah, that was about it for today.
All right, thanks. Yeah, and if anybody who wasn't with us when we did introductions, Karen Correa is the new representative of Jefferson County Health Department. So welcome, Karen. Bienvenida. And with that, let's move to our meeting notes from October. Is there any requests for changes or additions or omissions? Anything, any problems you see with the meeting notes from October? Can we pull those up real quick? I think if I'm not confusing them with the board's notes or somebody else's notes, I think there was like an action item, like a follow-up type of item, and I'd love to see those highlighted in yellow like we used to do. Was that here? Staff will notify the
action items. Yeah, we didn't have any.
Only one that has to do with actual like CAC actions. Maybe it wasn't these. Oh wait. It might have just been this will be added to the future meetings agenda. It's just a good way for us to kind of make sure we're holding ourselves accountable. And we have added that to this agenda, so good job. All right, so if nobody has any objection to accepting the notes from the last meeting, we will, that's the way we'll do it. Instead of voting, you need to object to not approve them. So we'll go ahead and approve those. Thanks, everybody. And one other thing, is there on the screen that you're on, does that have the attendance from the last meeting? It's usually like at the top. I just wanted to point out that we had great attendance, which always makes me happy because that's why we're all here. And I think we're almost doing as well this time, pretty close. So thanks, everybody. All right, with that, we're going to move on to our small group breakout sessions. Karen, you may not know that I think you're the only new member with us. I'm not sure, but I think so. Each meeting we spend like 5 to 10 minutes in small breakout groups through Zoom and just talk about a question that gets raised. So we're going to do that. And Kelly's going to push us into those rooms.
Yeah, so with the upcoming holidays, I thought an appropriate question for today would be, where is your favorite place to gather with family and friends? We'll give you about 10 minutes or so to discuss, and I'll send you to your rooms now. Okay, everyone is back.
Welcome back, everyone. I hope you had a nice get to know you conversation and shared some stories about gathering together with those you care and love about. So next item on the agenda is doing some follow-up with emerging issues. So if you recall, over the last year, you all have taken multiple steps towards advocating for addressing some of the larger system issues impacting dental and periodontal care. Most recently this spring, y'all had a large conversation with the DCOs and OHA partners. You've also had a member, Teresa Olander, submitted a public comment to one of the Oregon Health Authority committees called HERC that makes some decisions on what's reimbursed. And then you all also agreed to continue that advocacy. So what we wanted to do was build in a little bit of time into the meeting for you to have that opportunity to write in small groups from you as individuals, letters asking for some system level change. So what we've done is developed some templates that you all can personalize to your stories or somebody's story in your small group. To then you can do that, and then staff can send it off to meet the deadline for their next meeting. The thought is that we just start bombarding them with letters so they get the continued message, and then we can add other CACs to that as we go, and continue kind of just poking and keeping it in the forefront of their mind and eyeballs. So what I'll do, any questions about that, then I'll go into the show you the template and kind of give you some instructions on that. We just have 30 minutes, so we might not get done, but those folks who are done, we can set it on. If not, we'll set up some additional time to finish them up. So questions so far about the concept of what we're going to do for the next 30 minutes? And I have a lot of names and no faces, so help me out, folks. Thumbs up, a nod.
I do have a question. The fee, the 1/3 pay, the low amount of money the podiatrists get, I think we need to address that because if they are supposed to get 300 and they only get 100, that's a lot of training for accepting peanuts.
Yes, agreed. And so the two advocacy letters, the two big issues that are the two big barriers that are holding back payment are, or holding back services, I should say, that you identified was workforce. So investing in workforce development, because there aren't enough dentists and periodontists. And then the other was reimbursement rates, because it was identified that OH folks providing services in OHP receive 35 to 40% of what other insurances are reimbursed. So in just a minute, we'll break into small groups. we'll give you each a link to the Google document, and somebody in your group who's comfortable working in Google Documents can get in and be scribe. If you don't have one of those, that we're trying to arrange it, one of the staff will come in and help scribe. But in your small group, you will choose to start with one. Do you want to write in about workforce, which is on the page 1? Do you want to write in about reimbursement rates, which is on page 2? Or do you want to write your own regarding periodontal and dental? And this is a your choice and just kind of a really basic format for a letter, an advocacy letter. So I'm going to stop and invite questions on the tactics. Yes, Linda, you're muted.
Thanks. I pushed the wrong button to unmute. These are written from OHP clients. For those of us that are on the committee that are not OHP clients, what is our role here?
You can adjust it to say, hi, our names are, and we are OHP clients, and I sit on the Community Advisory Council. So whatever you need to kind of personalize it is all fair game. These are just drafts. Make them yours. Other questions about this, Elizabeth?
Because of the low rate of reimbursement, I don't think you're going to get very many staff. I don't think you can enlarge the staff to work for nothing. I mean, if we get the rate up, I think then you'll have more staff.
Absolutely. So if you, in your small group, Elizabeth, if you want to work on the reimbursement rate letter, go for it.
Okay.
Yeah, it's totally, or if you want to work on your own, so this is just a place to start. Other questions? Mandy, Tom, Karen, Connor, Stacy. So Kelly, do you want to, what I'm going to do is put the link for each group into the chat right now before we go into a small group. So whoever's acting as scribe and comfortable with Google, you're going to bring that, you'll have access to the link in your chat. So you can click on the link and open the document. Kelly, do you want to give me the names of the folks, small groups, and I will start.
Sure. So I have group A, that's going to be Brad, Stacy, and Karen.
All right, hold on. Brad, Stacy, and Karen. And then I'm going to put this link in here.
And just to clarify, Gwen, is our goal to get 1 letter out of each group or 3 letters?
You're welcome to decide. Ideally 1. If you can do more, do more. We only have, 20 minutes at this point, so.
Okay.
All right. Yeah, maybe start at the, so yeah.
Okay.
Okay. All right. Next group, Kelly.
Group B is going to be Connor, Linda, and Elizabeth.
Okay. Next one.
And I have one more group for the CAC members. Group C, Mandy, Maida, and Tom.
All right. That link doesn't share link. Okay. Go. When you break into small groups, if you're having any issues, click call for help, and myself or one of the staff will come in and help you out. Yes, Brad.
So I'm seeing in the group A Google Doc I think everybody you've added has been added to this same doc. Is that the way this is supposed to work?
Yeah, I
No.
see all three letters.
All right, let me try it again. Do you know who y'all are with?
Well, they says like anonymous jackalope, anonymous kraken, anonymous elephant. So I don't know.
Yeah, so 3 of you should be in to one in. So in group A, you should see 3 people in group A document. There's another,
I'm seeing 5.
yeah, that's probably me.
Or I guess there's you and the one extra. So there's 4 plus you.
Yeah, which would be potentially accurate. So group A.
Okay.
Yeah.
My link took me to group A,
And Connor, you're in.
group B.
Okay, let me try this again. Group A. Copy link.
Yeah, those are the same links for A and B.
Right.
And let's see.
B.
And then we'll end up in Zoom groups.
Yep.
Okay.
All right. Group B, group C. Okay, those are working. Okay.
And Gwen, you said if we need help, we can request help. How do we do that?
There's a little button on your Zoom screen that says call for help. We'll be right here.
Linda, that'll appear once we are into our.
Okay, got it. I'm not seeing it right now, but
No,
Yeah.
not until you're in the rooms.
okay, thanks.
We
All right,
aren't
we
far
all-
away.
Are we all ready?
Yep.
Yeah.
Yeah.
Thanks, welcome back, everyone. So I am confident that many groups are not finished. And we knew that going into it. And what I'd like to do is do just a quick check-in with each group, sharing if you chose what you chose to write on, any if you're done or need additional time, and if there's anything else you need staff or your council members to know what that could be. So super informal, super quick, because we have a couple of great presentations coming up that we don't want to steal time from. So group A, which was Brad, Stacy, and Karen. Give us a quickie rundown. Did you land on a particular template? How far did you get? Anything you need?
We went with the reimbursement template, and currently I believe we're gonna go with like sharing my story, my experience, especially because I'm still on the OHP plus, and so I was mentioning about dental appointments for myself while I was pregnant with my son, and how my doctor has shared that those are very important. And to me, it was really hard to get in and be seen in Madras. Oftentimes, the appointments were just Redmond or Bend, and it just sometimes wouldn't work with my work schedule or daycare and childcare schedule. So that was still trying to finish it and write it out, and hopefully share it back on the Google Doc.
Okay. Thank you. Thank you.
Of course.
Yeah. All right. Group B, Connor, Linda, and Elizabeth.
Like group A, we tackled the reimbursement one. We added a couple additional risks. One included pregnant women having higher incidence of premature births due to poor oral health. And we also decided to move the patient experience up below the second sentence. So we we wanted to bring in that personal, pulling of the heartstrings earlier in the letter, just to get people to relate and experience what we're trying to convey.
Excellent. Thank you. And are you still working on it? Is it done? Need more time? Just.
Well, so we left areas for the personal experience and stuff like that. The one thing that we didn't add is we added heart disease is an increased risk. We were hoping to get one other increased risk just to highlight that. So there's a parentheses in there adding, asking to add one more risk. But I think for the most part, Linda and Elizabeth, if I'm not mistaken, we're pretty happy with how it ended up.
All right. And do you need a resource for that increased risk, or do you have access to find that one? Do you need any help from staff?
I can try to do some research,
Okay.
or Linda or Elizabeth, if anyone wants to help.
Sounds great. We'll wait to hear from you then. If you run up against any walls, let us know.
I'm lazy. I think help from the staff is great.
All right, we'll connect offline. Connor, let me know, do some looking, and then we can support you in that.
Okay.
And then group C, Mandy, Myra, and Tom.
So we went with workforce development and just a general personal story about people having to travel to Eugene for periodontal care, and and having insufficient medical travel and reimbursement programs if able to travel there at all. And then the risk of health deterioration if unable to travel to get that care.
Excellent. And any barriers or support from staff that you need?
I don't know. We said we were done. So Tom, Myra, what do you guys think? Should we make it more personal, or is it good?
I thought it was good.
Yeah, I thought it was good. I think we did a good job.
Right. Sounds great. Excellent. Well, nice work, everyone, in our tight 30 minutes. Well done. Well done. Very exciting. All right. So we'll circle back on this again in different ways, I think. And this is, of course, the first time we've done this. So it's, learning for all of us. And with that, I'm going to hand it back over to Brad to bring in the next agenda item.
Thanks, Gwen. Thanks everybody for working on that. And just in our group, all of us are actually going to write a letter. So we all we talked for a little bit, and then we split off and started working on our own individual letters. So we'll get those to you along with Karen's. So now we have Elaine. Is Elaine with us? I didn't see Elaine. Or do we have other representatives from Mosaic?
Yeah,
We have Regina.
Elaine.
Hey, Regina.
Elaine's not able to make it
Renita,
today. So we have
Martha.
Gina and Martha here.
And I saw somebody else. Who else joined us? I guess that's it. Go for it, Regina and Martha.
Yeah, thank you for having us here. And I know Elaine is bummed that she couldn't make it. I'm a community health worker supervisor for Mosaic Medical, and Regina is a community health worker for us. And one of the things that we wanted to bring up today is the barriers and challenges we're having with transportation, not just through non-emergency medical transport, but just transportation in general is very hard to get right now. OHP is partnered up with Pacific Sources partnered up with Motive Care to provide transportation, but we are having an issue with lack of staff on their part, no shows on the cab driver's behalf, late cancellations on their end with no notification to us, and we're unable to schedule on a short notice. Most of our patients, not just the ones that benefit from this benefit, they're going through some life events, and their timer, their clock does not go past today. what am I going to eat today? What am I going to do today? Where am I going to rest? And so we see a lot of patients with those last minute requests come, and it's really hard to get them the help that they need. Even if they scheduled their appointment, 3 months in advance, they're not thinking that far. And so us being unable to provide that transportation is a huge challenge right now. Yeah, I will let Regina talk about her experiences.
Hello, everybody. Nice to see you in a different setting. So to piggyback on what Martha has said, it is a huge, huge barrier. Last minute rides, especially like follow-up for EDs, patients trying to get in to see their providers the next day or the following day is sometimes challenging. Even more challenging if they're in wheelchairs or stretchers, things like that. Those ones are harder to get scheduled. And then also wait times. Sometimes if they're not picked up on time and they get to their appointments late, then some places can't see them anymore. And, after you've been late 3 times and haven't been able to reschedule 3 times, those barriers there kind of kick you out of the clinic depending on their rules and their the expectations. And during that moment, while they're waiting for their rides, they're not thinking about calling the clinic, or if they do call the clinic, is the clinic going to answer on time to consider this cancellation versus a no-show. So those things also are huge barriers when we can't get transportation on time. Or sometimes our patients will set up as a will call, that meaning that they'll call them once they're done. Before, they would advise them it would be like 60 minutes before they would be picked up. But now we're seeing patients waiting for 2-3 hours before they're even picked up. And the instruction that they're given sometimes is communicated correctly or incorrectly. And so they get that runaround, like, who do I call? Where do I start? And so those are huge barriers. When we see a client or a patient in the waiting room for that long, might have back issue, things like that. There's just so much. The communication with the transportation companies that we're contracted with are not the most easiest to communicate with. Us as CHWs, if it's hard for us to communicate with them, I can imagine how hard it is for a patient to communicate. So there's a lot going on in that area. And I think Martha also, I think in the past, we also had a committee, or you may have had a committee with connecting with these issues in the past. I don't know if that group still exists at this time, but maybe if we reinstate that group just to bring our barriers to the table to see if we could improve or if it's improving.
Which group was that, Regina?
I don't know. It just says the NEMT committee at one point, probably before COVID.
Can anybody help
familiar?
us?
So COIC, Central Oregon Intergovernmental Council, I believe that acronym, when they were the non-emergency medical transportation provider, so it was CERC, Cascade East Ride Transit, they held, I believe it was a monthly non-emergency medical transportation group. And in that group or around that table would have been some of like the drivers or like owners of the cab companies or driver for the cab companies, the like ambulance companies, but like the lower level ambulance, like the stretcher transports. And then there would have been like maybe Mosaic, St. Charles. They all would have come to the table to talk about any issues that they're having and things like that. And then in end of April 2020, Motive Care took over the contract in the middle of COVID.
Mhm.
and nobody was using medical transportation, and
Wow.
everything was telehealth, and it just created this cascade effect that we continue to see today, where staffing up drivers has just been really challenging. But I think that it would be really good to get that group going again, and then maybe explore other ways to provide medical transportation and see, there's like Uber Health and things like that, maybe we can look at that. I don't know. So I know
Yeah.
transportation's been an issue for a really long time. So I'm happy that we're going to talk about it here.
So,
Yeah.
oh, sorry, Linda.
It's okay. I was just going to say that I'm glad that you guys have brought this up again, because it sounds like the situation has not improved in the way that we hoped it would. And it makes sense to me, A, to communicate initially with COIC because they're overseeing the contract, as I understand. And B, to see, are there sources of data that we can collect in terms of either from the cab companies or from physicians' offices? Are they actually struggling with a lot of no-shows from clients who need transport? If so, how many on average on a month, or whatever the data is, so that when we approach and sit down to talk about how big the problem is, we have some data to support it.
Yeah, for sure. I just know, like in an experience, if we are the ones to set up, maybe not for Motive Care, but just working with some of our cab companies, they're very hard to communicate with. And sometimes, you're just not confident that the ride has actually been set up. And so that's a barrier. So I don't know like how that looks on Motive, on Motive Care side. But if it's hard for us, I can imagine the communication for them, unless they use a different way of setting them up.
And Mosaic is partnered with quite a few cab companies. They will send us invoices and we pay them. We will get those bills taken care of, but we're still having that issue of, are there enough drivers? Will they get there in time? Can they wait? And it is a big barrier. At the beginning, we were using Uber and Lyft. We were asked to stop due to liability in our insurance, but I know that there are, across the nation, Uber Health is being used. And I think that that would be extremely beneficial to everybody. If I don't know if Oregon is doing it at all or only certain parts, but that would be extremely helpful during this time where we don't have enough transportation.
Yeah.
So, Kristen, Kristen clarified in the chat that Motive Care holds the contract. COIC no longer holds that contract. Motive Care has a reimbursement problem for those who transport themselves. Okay. So what, Kristen, can you tell us anything? Like who makes the decision? Who makes that decision? In terms of if Uber Health is an option, or like how does that decision get made?
I'm not exactly sure. I don't know if that's something where like the CCO would investigate or look into how to contract with like Uber Health, for example, directly. But I've been taking notes and will ask. I can say that non-emergency medical transportation is also our top complaint that we receive from members and from probably providers as well. So, but I will ask about that and ask if there are, just other ways to provide this transportation, because obviously Motive Care is having a difficult time with staffing and accountability. So, and I will also say that in Marion and Polk, which is our other Pacific Source CCO over in Salem, they actually had a panel or a listening session with NEMT. So Motive Care came virtually to their table. Wow. And they had a conversation like we sort of had with the dental care organizations. So I just wanted to put that out there that Elaine, who's my counterpart in that region, felt it was pretty successful.
That's a great suggestion, Kristen. The other population that I worry about is not an OHP population, but it's the Medicare population, seniors in particular, because there's probably way more of them that need non-emergent transport than OHP members. So that might be an additional database that we could look at to see if they have any data on ride provision to seniors.
Yeah, to piggyback that, Linda, that is one of the hugest barriers. Like they qualify for QMB, which where the state just pays their A and B, but then that dual coverage is not there. They're on fixed incomes, can't afford, to purchase anything that provides transportation. And we find ourselves, leaving them out, and they're the ones that are the most in need. And also the routes, have changed due to the increase in gasoline. We just found that, like the route, just the transit routes that are happening when they go through Terrebonne, they pick people up to take them back into town for Redmond, but at 7:00 a.m. and 8:30 a.m. Are the two stops. But to go back with groceries or just anything else outside, I know this might be off topic a little bit, but outside is at 2:00 in the afternoon. What do you do on these cold days waiting for a bus to come back to pick you up? So
right.
If our seniors are using those things because they're able to walk to a bus stop because they don't have transportation benefits, that's a huge barrier.
Right.
Well, it definitely sounds like this is an issue that we want to take some action on. Just a question of what that action will be. How much time do we left on this topic? Looks like we're kind of out of time on this topic, but let's push it forward to the next December meeting, maybe, if we can fit it on that agenda. We already kind of have a draft agenda put together, and if not the December agenda, then as soon as possible after that. But we'll try to.
Brad, I can offer. I've got a meeting with Tammy next week. I'd be happy to mention this to her to see if she has thoughts on who we should talk to and how we could go about it, even though they're no longer the responsible contractor.
Okay, I think that'd be great. So Tammy's the executive director at Central Intergovernmental Council.
Well,
okay.
Thank you for having us.
Thanks for sharing all of that. It's really good information, and it's really good to know. I mean, it's not good to know, but it's good information to have. That you're seeing this as a really critical issue. So
yeah, well, thank you for having us. Hopefully that's some good information to bring to the top of the chain.
Yeah, and if you are able to provide any kind of data like Linda was requesting, on how many of your patients are struggling with this, that'd be really useful too.
Yeah, for sure. We can chat offline with Martha and see how she can get that, or how we can get it.
Okay.
Along with Elaine. Thanks for having us though, guys, and listening to our barriers in transportation.
No, thanks for joining us.
Yeah, it was good seeing you guys. Bye.
See you later.
Bye.
All right. Well, with that, we're going to move on to a discussion about Connect Oregon, an update with Best Jamie.
Jamie. Yep.
Jamie.
Hi, everyone. I'm Best Jamie. I'm the Social Determinants of Health and Equity Program Manager at Pacific Source. And Kristen invited me today to come and talk about Connect Oregon a little bit and get some of your insights and feedback about how we can continue to build the Connect Oregon network in Central Oregon. So I know we've just got about 10 minutes, so I'm going to share my screen and present a little bit of data to you, some information, and then have a discussion if we have some time. All right, so I'm gonna move pretty quickly through these sort of level setting slides in case anyone here is not familiar with what Connect Oregon is. And then talk a little bit about who's on the network and what their level of utilization is, and then pick your brains a little bit about how we can do a better job in getting more people on the network to really meet the social needs of our members. So essentially, Connect Oregon is a technology platform that helps to make electronic closed loop referrals between healthcare providers and social service agencies. And a closed loop referral is just essentially a referral that's made through the platform, and then the sender of the referral actually gets to see the outcome. So they get to see if that referral got accepted by an organization, if they took action on it, and how that referral was ultimately closed out, whether it was successful and they were able to get the member the service that they needed, or if it was rejected for some reason, like the client got their needs filled another way, or they weren't able to get a hold of them, or however the referral was ultimately closed out. So it's a way to be able to see that in real time through the electronic platform, share confidential client information, track those outcomes, and then really inform the community-wide discussion about what resources are still needed in the community. This is just a quick slide, and I'll share these slides with you and you can kind of look at them in more detail, but just sort of how a referral works on the platform. Essentially, anyone at a provider office or a community-based organization can work with a client, identify a need, put the referral in through the Connect Oregon platform, and then someone receives that referral and helps get them the service delivery. And then again, everybody's notified all along the way to make that closed loop referral happen. This is just a really quick map of the footprint of Connect Oregon throughout the state. By the end of the year, they'll be in all 36 counties in Oregon to greater or lesser degree. So for example, we know in North Klamath, as part of Pacific Sources CCO region, we have Connect Oregon there, but the CCO in Southern Klamath County is using a different platform. So this map is accurate-ish, I would say, but the network is growing, and which is nice for for folks around the state. If they move, they can they're still using a technology they're familiar with. Okay, so this is kind of where we'll get to the meat of it. So one of the goals of Pacific Source when we adopted Connect Oregon was really to get the key healthcare providers in the region on the network, using it robustly to connect their patients, our members, with the social services that they need. So when someone comes into a doctor's office and they talk about the fact that they are food insecure, or they're unable to pay their utility bill, or they could really use some help with transportation, as we all just talked about, a staff person, either the clinician or their back office staff, could help get that person connected to a resource through the network. So we have done a lot of work in doing outreach to providers and community-based organizations providing those services to get them on the network and using it robustly. So just to give you a snapshot of what the network looks like in Central Oregon, to date, there's about 86 organizations that are on the network, with over 500 users from those organizations, and then 153 programs available. The cool thing about what's happening in Central Oregon is that almost 70% of the programs on the network are receiving referrals, which is higher than a lot of our other CCO regions, because folks can get on and choose just to be a sender of a referral and not actually receiving referrals, which, as you can imagine, kind of creates a barrier for folks if they're not actually able to, if there's not any organizations that are actually taking referrals at that time. So, and then this orange highlighted box is really just to show the network growth over time as organizations get added to it. And in this context, organization means both community-based organizations, nonprofits and the like, and healthcare partners. And then if we drill down into how many clients are being served, to date in 2022, so since January, over 430 clients have been served. Each of their needs gets set up with a case. So if a client has a food need, a housing need, and a transportation need, each of those becomes an individual case. And so that's why the number of cases is greater than clients. And you can kind of see in the case volume over time just how needs have ebbed and flowed, or really usage on the platform. It's not necessarily a great indicator of overall need, but as usage of the network has ebbed and flowed coming out of really the height of COVID, and then into more just sort of steady utilization, how the case volume has changed. And again, happy to send these slides out so you guys can dig into the data a little bit deeper. So for our network in Central Oregon, we have a list of high priority healthcare provider partners that we wanted to get on the network. So we're working with Unite Us, the technology company behind the platform, to do outreach and have conversations with folks and show them how to get onboarded. And then we are internally tracking sort of the network health, like how robust of utilizers these folks are, because if they aren't doing, even though they're on the platform and they aren't really active on it, we want to know that so that we can go and have a conversation and find out what the barriers are to that, and get them using it more as part of their everyday workflows. So you can see here, the year-to-date referrals really indicate how active they are. And we have a metric, 65% of these key providers being in the active status. And so we've got some work to do, both getting folks on the network and using it more, but there's also some good activity that's happening with some of these providers as well. And then from the community service side, we identified 4 organizations that really serve members' cultural and linguistic needs in Central Oregon. And we wanted to make sure these folks were in an active status, which was Mosaic Medical, Latino Community Association, the Central Oregon Disability Support Network, and Volunteers in Medicine. They all are onboarded onto the network. And other than Volunteers in Medicine are using it each quarter pretty well. So we want to continue to build out this list of culturally and linguistically responsive organizations. And so, that's what we're working on now too. So I blew through a lot of that information very quickly, just given the amount of time. And I know we're almost at the end of the hour, but just given all of that, what you've heard, thinking about, what primary social needs of members that they're experiencing now in Central Oregon, or other organizations that you know of that you would want to see on the network. Is there anything that I can, answer for you in terms of questions or think about as we build out more of the Connect Oregon network in Central Oregon, especially in rural communities? I'll highlight, because knowing there's a lot of need there. So just want to open the floor to feedback or thoughts.
Anybody have questions or thoughts, comments?
And it might make sense for me to come back when we have more time to really dig into the data and to, the discussion around who makes sense and how we can do a better job. Because I know that those are big questions with a lot to dig into and without much time.
So maybe what we can do, because I'd like to actually continue talking to you, because I'm one of those organizations and I have lots of thoughts and questions, but I'm not really sure that everybody needs to hear that conversation, that it would benefit everybody, I guess is what I'm saying. And I saw that Myra had to jump off. So if anybody else has to jump off, feel free to, but you can also stay on. And if folks don't mind, like another 5 minutes or so, those who do want to stay on. And if you're going to jump off, thank you very much for participating today, and we'll see you in December.
Thanks, everybody. Have a happy holidays.
Thanks. So as one of the organizations who did take this on, and we, just dipped our toe in the sense that we only used it for a specific service, and that was the wraparound quarantine assistance.
Mm-hmm.
For the families we were serving with, Oregon Health Authority dollars, grant dollars. who are quarantined or isolated due to the pandemic. We were, providing, we partner with the health departments, all three, to provide them with groceries and help with the rent and utilities and so forth. And it worked really well. All three of we had 3 women on our team that were doing that work, and they really loved the platform. Thanks, Mandy. And because, that's the one thing, like I think one of the biggest challenges is everybody has their own database.
Right.
We have our own database, and but our database does not track external referrals. And I think most people's databases don't track external referrals. So that's one of the big pluses of Connect Oregon is it's a plus in the sense that you can see, Stacy, you can, do that external work between organizations that pretty much nobody was able to do before Connect Oregon that I'm aware of.
Yeah.
The downside is unless everybody that you do referrals with typically participates, then you're still using 2 systems, or maybe more than 2 systems. So I think that's the biggest challenge for a lot of, in particular, and I'm not sure why Crook County and Jefferson County health departments haven't chosen to use Connect Oregon, but there's some things to think about.
Yeah, definitely. The interoperability between systems, I think, is one of the biggest barriers, especially for, our healthcare partners that have EMRs that, again, just to your point, you're working in 2 separate systems and having to track data in 2 places. And that is definitely, I think, the biggest barrier to entry at this point. And I think that, Unitas as the technology company is working on helping to lower the costs of that interoperability connective points, essentially, because basically they charge for that, and it's not cheap to try to get something integrated into a data system that already exists. But I think they're working on that because they're hearing over and over again that is a barrier. So it's a known issue, and one we're tracking and trying to help support as the network matures. But it's yes, I just acknowledge that's definitely an issue. Yeah.
Anybody else have thoughts, questions, comments?
Okay, well, I will send the deck to Kelly to share with you all. I'm here at your service if you have any specific questions or thoughts as you marinate on it after the meeting, and I'm happy to come back anytime as well. So thank you so much for the invite, and I hope y'all have a great Thanksgiving.
Thank you, Bess. All right. And the other thing around like medic OHP in particular, like most of the providers have, well, I don't know if most, I'm not sure how that's working with OHP, but like in our case, we have certified assisters. Mosaic has certified assisters, and so it's all done between us and the one system at OHA. So there's no need for Unitas in that case, at least not that I can see. So specific to Medicaid and OHP, I'm not sure where they come together or how it could be, useful. Maybe for transportation services. Get Motive Care on there. Is Motive Care on?
Yeah, they are. And
They
certainly,
are? Oh,
yeah.
okay.
And we have Pacific Sources internal care management staff are all users of the platform too. So those referrals can happen both to, they can refer directly to Motive Care, but if there's other providers that are in the area that also get on board, then that may be a way. But man, that's a tough nut to crack, and I think in all of our regions for NEMT for sure. Just because of the shortage of drivers, and Kristen spoke to that a little bit already. So
yeah. All right. Well, thanks everybody. Anything else before we part? Anybody? I think we're good. All right. Thanks everybody. See you in
Thank
December.
you. Bye-bye.
Bye.